الموضوع الثالث اليوم هو عن ال HIV. طيب, those are the objectives. طبعا, given the fact that HIV it's actually a relatively modern disease, يعني since the 80s, we're going to spend some time talking about even the discovery and where we are today with the HIV. طيب, in 1981, it's the first report of PCP infection among healthy individuals. And it was known back then that PCP usually affects immunocompromised people, okay? And then fast forward to 1989, there was a publication when to give PCP prophylaxis in person with HIV. So you can see that in a matter of 8 years, a huge developments in the HIV recognition, HIV management, okay, in just a short period of time. How about in Saudi Arabia? The first case of AIDS published in 1984 from King Faisal Hospital and Research Center. So we were actually part of this global phenomena, discovering this disease and try to fight it. So in 1983, HIV was isolated from patient with lymphadenopathy. In 84, HIV was demonstrated to be the causative agent for AIDS. In 1985, the ELISA test was developed. So huge developments in a very short period of time. This is just an example of the global HIV data, and you can see, we can take some of the examples. When it comes to the AIDS-related death, we can see back in 2000 we're having 1.4. Now in 2018 it was less than a million, so 770,000, and this has been contributed mostly to the effective anti-HIV therapy. When it comes to, for example, people living with HIV, we can see the numbers were only roughly 25 million back in 2000. Now we have up to 37 million people. So the numbers are increasing again because they can live with HIV, given that we have a very effective HIV medication. Okay. So how about the incident in Saudi Arabia? Well, the cumulative number of HIV infection among Saudi nationals over the period of time from 89 to 2017 was 7,600. Okay, in 2017 we have 427 newly diagnosed HIV. Okay, usually the diagnosis is being made in the 20s or in the 30s. And less commonly during childhood. Okay. Late HIV diagnosis of all persons newly enrolled in the HIV care in 2017, and this is in Saudi Arabia, 97% have an initial count to know where they are, and their first initial count was less than 350, and 20 up to like 20% to 25%, their CD4 count was less than 200. So this is considered as a late diagnosis. So we have a lot of individuals being diagnosed with HIV in Saudi Arabia, but the diagnosis was made basically late. Okay. So this is alarming. We like to diagnose them early so we can give them the effective anti-HIV therapy so we can keep their CD4 count naturally elevated. Okay, so HIV and AIDS, well, HIV basically is infection with a human immunodeficiency virus, that's the name of the virus, which can lead to chronic and without treatment, usually fatal infection characterized by prolonged and progressive immunodeficiency, long latency period, and opportunistic infection. What's HIV? It's RNA lentivirus belong to the retrovirus. There is two types of HIV. HIV-1 is the predominant worldwide. HIV-2 is mostly habitant of West Africa. Okay. So what's a hallmark of HIV disease? Well, there is an infection and viral replication within the T cell lymphocyte, okay, expressing the CD4 antigen. So T lymphocyte, we have CD4 and CD8. So a virus goes and infected and replicate within the T lymphocytes expressing the CD4 count, which can lead to progressive depletion, yani reduction in the CD4 count. Okay, so what's the rule for the CD4 counts T cell? Well, one, they are fighting the opportunistic infection like PCP, as well as fighting the neoplasm such as lymphoma and Kaposi sarcoma. So guess what? When you don't have CD4 count T cell, you are prone to have an opportunistic infection as well as neoplasm like lymphoma and Kaposi sarcoma. So HIV are primarily found in blood, semen, vaginal fluid of the infected person. It's very fragile virus, so it cannot live outside the body for a long time. Mode of transmission, well, probably most of us know by now that's sexual, whether through heterosexual or men sex with men or other form of sexuality can lead to this transmission. Heterosexual remain the most common mode of transmission worldwide. We also have the vertical transmission, meaning from women, from a mother to her newborn, as well as IV drug use and bloody fluid. There is no evidence of spread by a casual contact. So, what is the pathophysiology? Well, early stage, there is a massive replication of the virus within the lymphocytic tissue, okay? And subsequently, this will lead to chronic immune system activation and determine the course of the illness. So, a massive replication that will have some symptoms, we'll talk about it shortly. Eventually, there is a permanent viral reservoir containing proval viral DNA in the latent T cell. So the viral DNA, RNA, will be contained within the T cell or sometimes the macrophage. So during the acute infection, and this is usually happen after 2 to 4 weeks of exposure, it's basically resembling infectious mononucleosis. So they will come with fever, pharyngitis, adenopathy, rash, malaise, fatigue, and oral ulcers. So this is a state of acute infection. And then the virus load will fall down and the symptoms will resolve, okay? And there's going to be a bit of a rebound in the CD4 counts, but it will remain below the baseline. Okay. بشرحها بالعربي لأنه this is a very important. يعني بعد ما الواحد يصير له exposure لل HIV virus, there's going to be an acute phase. An acute phase هذا طبعا من replication of the virus within the T cell. الsymptoms حقتهم resembling infectious mononucleosis, fever, adenopathy, rash, fatigue, sometimes oral ulcer, pharyngitis, بعضهم حتى يصير عنده diarrhea وأنوركسيا, a lot of symptoms, GI as well as just overall the body feeling fatigue, okay? بعدين ال HIV RNA level will fall down, the symptoms will resolve, so they will feel better. حتى CD4 counts, they will rebound, they will elevate it just a bit, but it will remain below the baseline, okay? So what's happened after? Well, they will be in an asymptomatic chronic phase, during which there is still an active viral replication is going and progressive. وبعدين a patient with high HIV RNA will progress to symptomatic disease مقارنة بالناس اللي عندهم low HIV RNA. So the more viral RNA you have, the more symptoms you may have. Okay. وبعدين there's going to be يعني a lot of changes in the immune system. Eventually, it will lead to the immune system to be shut down and causing the AIDS. Okay. Any questions so far, guys? You guys took HIV in the medicine one, or this is a new topic for you guys? أخذتوا ال HIV بالميديسين 1؟ Okay, good. So let's focus أجل على الحين الانفستيجيشن والمانجمنت، لأنه أكيد إنكم أخذتوا عن الإبيديميولوجي. طيب. Diagnosis. Well, we have the ELISA. ELISA really, it's mostly being used nowadays for screening. يعني screening blood, the product, and patient. Okay, just for screening. But if we're really gonna try to diagnose someone with HIV, usually we use what we call the combo test. A combo test idea is to detect an HIV antigen, سواء HIV1, HIV2, will B24 antigen, and it's have a good sensitivity, more than 99.5%. Details will be coming soon. How can we confirm? Well, we can confirm it basically by the antibodies against the HIV1 and the HIV2, and this is also will help us to differentiate between HIV1, which is common globally, and HIV2, which is mostly on Western Africa. الPCR, well, الPCR really يعني can be used to confirm undetermined cases. اللي test مرة يطلع positive مرة يطلع negative. Undetermined cases, we may end up doing PCR for them. Also to assess a viral load, because we talked about a viral load being affecting the symptoms, as well as those babies born with an HIV mother. And the idea is the following. They may actually, the babies may only contain the antibody. So they may not have the virus itself, but the antibodies will cross the placenta. So to know whether they have actually the infection, they have the HIV viral itself, you may do the PCR, okay? Because the antibodies will be positive, but that doesn't mean they have the infection. So this is an algorithm to help you out basically approaching HIV investigation. So first, you do the HIV 1, 2 antigen antibody combo. Whether it's negative, they are good. Doesn't have the HIV. If it is positive, you do the antibody to differentiate between HIV1 and HIV2. If you have HIV1 antibody positive, that's meaning they have the HIV1 disease. If they have 2, they have 2. If they have both, that's meaning they have both. If it is indeterminate, يعني not clear, you do the nucleic anti-acid. It's a kind of PCR to know whether it's HIV1 or not HIV1. I don't think we have the PCR for HIV2. Is this algorithm clear, guys? هذا يلخص اللي تكلمنا عنه قبل شوي. اوكي طيب هذا بس يعني clinically we talked about the sensitivity, but you have to understand the exposure timing is important. Okay, so the combo test, it's recommended to be done after 4 weeks of the exposure to detect 95% of the infection. Because if you did it yearly, it might not detect the HIV. Okay, and if you really want to rule out HIV, you will have to do it after 90 days. Rephrase, عفوا. After 4 weeks, you have 95% sensitivity. After 90 days, يعني 3 months, it's have 99.9% sensitivity. So if you have someone exposed to HIV by high-risk behavior, okay, you will advise them to do it after 4 weeks. If it is negative and you still suspect that they may have the disease, and this is false negative result, you will do it after 3 months. How about before 4 weeks? Let's say they insist to know whether they have HIV or not. You may actually do basically the viral load, the PCR. Okay? Again, very important and extremely important in clinical practice, because a lot of people, they will come right after their exposure. Let's say they have high-risk behavior 5 days or 6 days ago, and people will do the combo test. The combo test wouldn't be that sensitive. It will be sensitive after 4 weeks. Is this clear, guys? Very, very important in practice. A lot of people, they will rule out HIV wrongly by doing the test early on. Any question, guys? ما في أي أسئلة؟ طيب, let's move on. This is just a staging of the CD4 counts, which is the T lymphocytes. Normal individual, you will have more than 500. So if you have an HIV patient, they have more than 500, they will have normal immunity, basically. If it is between 350 and 500, this is a mild deficiency, may not cause any trouble. Between 200 and 350, moderate immunodeficiency. So it's put them at risk, but not that much. But less than 200, consider as severe immunodeficiency requiring some sort of intervention. Clinical manifestation, well, we may see seborrheic dermatitis, we may see oral thrush, hairy leukoplakia, Kaposi sarcoma, this is in the oropharynx. Lymph node, you will have generalized lymphadenopathy, so from lymphoma or TB or from the disease itself. You may have CV retinitis, especially if the CD4 count is less than 50. Of course, in the genitalia area, you may have ulcers and condylomatous lesions. This is the oral thrush, if anyone haven't seen that before. Condyloma basically is a genital warts, and it's secondary to a human papilloma virus. So they should get a vaccination. Any HIV patient should get an HPV vaccination for preventing those warts to be formed. So هذا يعني natural history over years between the HIV and the AIDS. So the average time from the HIV to the AIDS is around 10 years. So it's a long journey. And then once they have the AIDS, the survival average, it's only 1 to 2 years. Okay, but there is variability between individual. So some people will progress to AIDS within 1 to 2 years. Others will take longer, up to 20 years. We talked about the stages, the virus transmission. This is the exposure, and then the acute infection usually happen between 1 to 4 weeks, so an average of 2 weeks, and mostly resembling the mononucleosis symptoms. وبعدين seroconversion. So seroconversion meaning the test will be positive. We talked about usually will happen within 4 years, and then they're going to enter into an asymptomatic HIV infection period, whereas there is a slow progressive in the disease, and usually with no symptoms, and then eventually they will have a decline in the CD4 counts and reaching the HIV level, AIDS level. Those are the opportunistic infection. People with AIDS or severe HIV they may have. It's a long list of infection. Usually we don't see those in the left in otherwise a healthy individual, but the list is actually grow and large. So we're going to talk about some of them. So tuberculosis, it's the most common opportunistic infection leading to cause of death in HIV patient. Candida also, which causing this white coating in the mucous membrane, especially the mouth, tongue, and vaginal area. Toxoplasmosis, potentially deadly infection. It's from an organism called Toxoplasma gondii. It's basically a parasite spread primarily by cats and can cause meningoencephalitis. The diagnosis is usually by serology as well as MRI or CT for the brain, which you can see ring-enhanced lesion. The treatment usually a combination of pyrimethamine and sulfadazine, and they respond very well to those antimicrobial medication. What other complication of HIV and AIDS? Well, cancer is common. We're talking about Kaposi sarcoma, which is basically a tumor of the blood vessels walls, and it's one of the definition for AIDS. So when you have Kaposi sarcoma, that's meaning you have AIDS, as well as you may have non-Hodgkin lymphoma. So what are the goals of the antiviral therapy for HIV? Well, we cannot eradicate HIV. HIV is not something we cannot eradicate, but the idea is to control the disease. So the improvement the quality of life, reduction of the HIV-related morbidity and mortality, as well as preventing them to go into AIDS state, basically, and try to restore and preserve as much as you can from the immunological function, as well as to maximize and durable suppression of the viral load. So what are the treatments aside from the antiviral? Well, we sometimes end up giving them prophylaxis, especially when the CD4 count goes below 200. So when it goes below 200, we'll give them Septra. It's the co-triamcexazole, and this is to prevent the PCP infection. Once the CD4 count goes below 50, we'll start giving them clarithromycin twice a day to prevent Mycobacterium avium enterozoa. This is the cousin of the tuberculosis. What's the indication of initiating antiviral drugs? Well, if you have any HIV patient, regardless what the CD4 counts, that's meaning they have indication for therapy. Post-exposure prophylaxis, that's meaning, for example, if someone being exposed to HIV patient, for example, through needle stick. You will give them treatment. And pre-exposure prophylaxis, that's meaning, for example, when their partner is having HIV and you don't want them to contract HIV, they may actually take pre-exposure prophylaxis. Okay, this is an initiative called 1990. Basically, they would like, because a lot of HIV patients, they do not know about the disease. This is from where this campaign is coming from. So the aim of this campaign is to, and this is in the state, to that they would like 90% of people living with HIV, they should know about their status, so basically screening, and 90% of those people having HIV, they should be in antiviral therapy, and 90% of those people on antiviral therapy, they should have a virally suppressed, so basically undetectable viral load. Well, prevention, قنطار خير من قنطار علاج على قولتهم. درهم وقاية خير من قنطار علاج. So it's basically preventing sexual transmission of HIV through safe sexual contact. Please notice that even with the use of condom, there is a still 10% failure rate. Circumcision is also reducing the chances of HIV acquisition. Stop using IV drug, especially in sterile way. Screen all blood and blood product. Consider post-exposure prophylaxis as well as pre-exposure prophylaxis. So the key is through, of course, education, counseling, and behavioral modification. Yes, and UU is basically when you have undetectable viral loads, that's meaning it's unlikely to be transmittable, okay? So we always gonna aim for undetectable level so we can prevent transmitting the disease to other individuals. How about pregnant ladies with HIV infection? Well, we know that usually it's happened in utero, yani while they are pregnant, or intrapartum. So mostly happen intrapartum, and the risk of reduction roughly from 16 to 25%. This is without antiviral therapy. Today, the risk of perinatal transmission is almost 0% with effective antiviral therapy during pregnancy and elective cesarean section when appropriate, when they have high viral loads before a delivery, and doing formula feeding. Okay, time for question, guys. Wolf? Guys, can you hear me? Can you? Ashwa, there is a moment I thought I'd been for somehow logged off the Zoom. Okay, that's reassuring. Okay, so why there is no vaccine against HIV? This is a good question. This is a good question. It's still work in progress, I would say. But one of the challenges, the HIV virus kept changing its RNA. So that's making an HIV vaccination very challenging. But there is still work in progress, and hopefully we'll have one يعني in the near future. But as of now, there is no effective HIV vaccination. Good question. Someone mentioned there might be a vaccination back in the 90s, maybe, but as of now, there is no effective vaccination. للأسف. يعني hopefully someone will discover that in the future. Any other question? طيب يلا الله يعطيكم العافية. Heavy day today. يعني we talked about the HIV, acute hepatitis, leukemia, lymphoma. But يعني it's a time to go back and read and bring your question during the next lecture. I will be more than happy to hear about any other question. It's يعني 3 big topics حقيقة today. Yes, of course. I already would send it to Dr. Amal, so I'm pretty sure she will share it with you.
دكتور عندي سؤال أو طلب.
Yeah.
وإيش؟ كان في توتوريال 13 وتوتوريال 14 من الأسبوع السابع، واحد اسمه لان كانسر والثاني كرونيك ليفر ديسيز. لما انشرحت كان احنا الأسبوع السابع يعني بداية ميد-ترم، فأغلب الطلاب ما حضروا، فهل في إمكانية إن احنا ممكن نحدد أي موعد في أي وقت يا دكتور تكون فاضي فيه ساعة نعيدها ولا لا؟
والله قد تكون بالصعوبة بمكان الحقيقة، لكن what I would advise إنه يعني يعني لمرة طبعا they should go over the topic. يعني I can't present the topic twice، بس إنه مثلا you can flag the organizer for مثلا next semester lecture they can attend electively. That's what I would advise.
تمام، شكرا دكتور.
Someone asked دكتورة محاضرات تقدر ترسلها لنا لأنها طويلة. Yes, all lectures should be, يعني would be sent to دكتورة أمل and she should share with you the slides. But again, I wouldn't advise relying on the slide only for the topics. The slides can give you some direction. I would say reading the topic يعني from top to bottom from a trustful resources would be the way to go. Okay. طيب موفقين إن شاء الله. الله يعطيكم العافية جميعاً.